Do you think you or someone you know has hoarding disorder? I'm Christy Bunda-Kamara, Dr. B, psychiatric nurse practitioner with over 20 years of experience, and I'm going through the DSM and demystifying the DSM. And today I'm talking about hoarding disorder. And with all of these disorders in the DSM, you have to meet several criteria. Hoarding kind of became popular with the reality show that kind of went in and assessed and helped people with severe hoarding disorder kind of find some stability and treatment in their life. But like all mental health conditions, there's a continuum. And maybe you're struggling with, that's not me. My house is not necessarily full of things, but do I, or the person I'm thinking about, have hoarding disorder? So the first criteria for hoarding disorder is there is a difficulty with discarding, like getting rid of things, and it has nothing to do with the value of that object. So this is not talking about collectors who collect things that, are specific and they have value to that. So this would be, kind of a wide range of difficulty discarding lots of things not related to their value. The next criteria is that they don't actually need the items, but there is a perceived need. Like, no, you can't throw away or give away that kitchen set because I may need it in the future. And so there's a perceived need for all of these objects. And I am not a hoarder, and I keep things that I think I might need in the future, right? So this is but I have no problem. So I don't meet criteria for the first one of not being able to let it go. I give away to organizations all the time with things that, I probably won't need. This, again, is a disorder, and there's an accumulation. The next criteria is an accumulation of these things that begin to impede the living area of the person's residence. And this is, if you think about those reality shows, those are obviously extreme. But if you or this person that you're thinking about has things all over their home that they just can't let go of, these are the criteria. And then the most important criteria is that it has to have clinical significance, impairment in their life, right? So we all have the right to collect and keep things that we want and that we have a perceived need for. When it becomes a disorder, there is a clinically significant impairment in function, okay? So if somebody offered to come and clean their home, they would say, no, you can't touch these things. Like, there's an impairment. They can't stop spending money. They can't stop collecting. It is impeding finding other things that they find enjoyable. It is based on anxiety rather than based on enjoyment. So the most important is that clinically significant impairment in function. The last two criteria we have in a lot of the DSM-5 diagnoses, right? It's not related to a medical condition or another mental health condition. However, you can have generalized anxiety disorder or agoraphobia or social anxiety and also have hoarding disorder. But making sure that we're not blaming the whole clinical picture on this one hoarding disorder. So what do you do about it? Cognitive behavioral treatment is pretty effective in this case, right? The way that you think has to do with what you are choosing. So if you think you need these things, if you think you can't get rid of them, then you will continue to have a problem getting rid of them. And so you would, really kind of work on your thinking so that you can make choices in line with what you want, right? But what do you want? Do you want to be able to enjoy your living space, to be able to invite people over into your living space? If those things are part of your personal vision for yourself, and yet you know that you wouldn't do that with all of these things in your home, then you're not actually making choices today in line with what you say you want. The mentally strong method is what we use in our clinics and what I teach. It's just a cognitive behavioral approach. And two of the categories that we talk about in the mentally strong method is anxiety and choices. Those are two separate categories. And I think this really talks about this hoarding. There's this fear of letting go, this perceived need. That is part of anxiety. What are we going to do with our anxiety? We're not saying you have to get rid of it. And that's why the reality show where it comes in and everything gets moved out, like, you know, that is what they've collected for many years. That's very intense or aggressive treatment for hoarding disorder. So let's look at how can we make this moderate to severe, maybe even panic anxiety that you're experiencing, bringing it down to a mild to moderate so that you can make choices to maybe let some things go and not continue to accumulate. I always say, you know, in the choices category, instead of, you know, hiring somebody to clean out your whole house, you take every day, and if you can't do it every day, once a week, and you find 10 things. If you can't do 10, make it a number that you can do, and you consistently let 10 things go a day, preferably, right? And they could be little. You can count one pencil as one of those things. Okay, so I'm not talking about, you know, big pieces, but if you can consistently do that and you're working on your thinking while you're making these small choices every day, eventually you can manage or take control of these thoughts that are causing you to choose to continue to accumulate. So that's how I would treat hoarding disorder. I know there's lots of great cognitive behavioral therapists out there. Get with somebody who will help you change your thinking so you can change your behavior. And also, you know, if you're going to do this professionally, some things might come up as to why. Why have you been doing this? What are these fears based in? Okay, so again, taking care of yourself, doing things every day that are attainable for you, and each day get stronger. That is a mental health journey, and we're all on that journey. I believe in you, and I believe that you are mentally strong. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.